Do screen or cartoon cause autism? If you are a parent, you need to hear this. Autism is not caused by watching cartoons or screen time. Autism is a neurodevelopmental disorder with strong evidence because of genetic and environmental factors. But here is where the confusion happens. Excessive screen time can affect delay speech or difficulty communication, some difficulties with the communication. Those are symptoms of autism, but those itself are not autism. It's just like that not every chest pain is a heart attack. Similarly, not every child have delayed speech or who is unable to make eye contact or who struggle playing other kids have autism. These are symptoms of it, just like chest pain is a symptom of heart attack. But we need way more symptoms in order to make a diagnosis. Just like, in order to make a heart attack diagnosis, there is a chest pain. Chest pain is left side. There are specific changes in the EKG. There are some blood markers. So when everything is there, then we say this is a heart attack. And if things are not there, then we may say, okay, this is a pneumonia, this is just a muscular chest pain. So similarly, if a child presents with delayed speech, there are other factors. Then that the child have, as I said, the difficulty making eye contact, communicating their needs non-verbally, and have lot of repetitive and stereotypies and lot of odd and eccentric behavior. So when both things combine, then we make it as an autism diagnosis. But it's important as a parent, as a healthcare professional, we need to help our children and teenagers to limit screen time, play more, talk more, learn some real life skills, because we are seeing a lot of poor frustration tolerance. Kids are having difficulty coping with failure, with the conflict. So these things they learn with the real life situation. So I'm not saying that screen time is not dangerous. It is dangerous both, as I mentioned, in your social development and frustration tolerance. There are a lot of depression, anxiety, comparison, low self-esteem because of suicidality, self-image issues that we are seeing, identity, where people may recognize their identity with someone who have more money or someone who they may start comparing. So there are challenges. There are some effect on their eyes. So there are challenges, but these are the not direct causes of autism. And the other thing is that every child develops at their own pace. And the second thing which I really want to highlight is please stop blaming parents if they have a child with autism. It's not a parent's fault. It is just, as I mentioned, the diagnosis, just like we see people develop hypertension, high blood pressure. There may be no family history of high blood pressure, and we may see people, there are so many family history of high blood pressure, and some family members they don't. So just like any other medical diagnosis, where we don't blame their parents or their families because someone was diagnosed with high blood pressure, diabetes. Similarly, autism is another diagnosis which can be due to many different reasons, but definitely not because of the parents' fault. So what parents can do, definitely limit screen time. American Academy of Pediatrics provide a family media plan. I think those are really good resources to provide more face-to-face, real-life situation, play dates, spending time with their families. And if you are in doubt, I think it's important to consult experts on it, so that if there is, because early diagnosis and early treatment has a good prognosis. And I always encourage knowledge over fear. So instead of being afraid my child has autism or not, I think it's important to, if you are in doubt, get the evaluations. And I will encourage you to share this video to other parents as well, because one informed parent can change a child's future. Thank you.